to do these and to stay in touch with not only our chamber members, but with the community in general. So many things are a struggle and a challenge these days. So we want to welcome everybody to the Pivot, where we are indeed a weekly series of informational discussions, informal really, and in the midst of and following the current pandemic, this event is presented exclusively by the Mount Pleasant Chamber of Commerce. My role as moderator is to introduce our guests, get the discussion started with some questions, and give those attending the event live the opportunity to participate by using the chat or Q&A function that Rebecca will be monitoring as we go through. Thank you for taking the time with your Mount Pleasant Chamber of Commerce to join fellow members in staying informed, to help you take care for your team, your clients and customers, and of course, take care of business in post-pandemic conditions. COVID-19 is a life and death situation for senior citizens here and everywhere. Senior care facilities have been particularly hard hit, with most living in lockdown and family members unable to enter those facilities. And all of that is being done to protect everyone involved. It's also a hot topic with today's guests, both of whom serve seniors and their families right here in Mount Pleasant. Let's meet them and get right into the questions. Our first guest is Diane Sancho. Diane serves as Executive Director of Alice's Clubhouse Memory Care Day Center in Mount Pleasant. Diane has devoted her life to caring for those with dementia. A social worker with 30 years experience, Diane co-founded Alice's Clubhouse with her business partner to improve the quality of life for those living with Alzheimer's, dementia, and their families. This is the first medical model day center for seniors with dementia, partnering with many other organizations to offer therapies, recreation, cognitive stimulation, and respite for caregivers. Diane and her husband adopted the Lowcountry as home in 2010. She lives in Mount Pleasant and is a proud mother of 4 children and grandmother of 1. Diane, welcome to the Pivot. We'll have to talk grandkids, but maybe offline here. Huh?
All right, John.
Love those grandkids.
Yes, we do.
Thanks
yes, we do. Thank you. Thank you for having me.
Sure. Next is Denis Kish. Denise is a long-term care and assisted living licensed administrator whose passion is to create cultures of excellence in the long-term care industry. As the administrator for Mount Pleasant Gardens, she is pursuing her passion and leading a team of professionals caring for those with dementia and Alzheimer's. Mount Pleasant Gardens was recognized earlier this year by HealthLinks magazine as Best Alzheimer Facility Memory Care in the Lowcountry. Before moving with her husband to South Carolina, Denise spent 18 years serving in long-term care, focusing on establishing new areas of service and establishing cultures of person and family-centered care for a comprehensive care continuum. That's a mouthful, Denise. She served as a speaker and consultant for many associations and long-term care communities. In her prior work, Denise and her team earned the American Healthcare Association's Silver National Quality Award. She is also a board member of the South Carolina Assisted Living Association. Denise combines her faith and years of experience to assemble teams that are passionate about the work they do and the families they care for. Welcome, Denise, to the Pivot.
Thank you. It's an honor to be here.
So glad to have you. Let's get right to the question, shall we? Diane, talk about how you've had to pivot with the day center in the face of the pandemic.
Well, we did have to pivot. We were closed, which created, a lot of issues for our families, because we have some families who are still working and trying to take care of their loved ones. So we tried to accommodate them as best we could by doing this. We had Zoom. We met over Zoom 3 times a week. We were able to have a rec program. We were able to talk to the caregivers. And we also had our nurse on Zoom, so they could ask any medical questions that they might have while they were trying to caregive for them at home. We are very happy to say that, all of our members have come back. We were, not sure, because as we all know, when someone has some dementia and some memory loss, when they get out of their routine, they can have, some backsliding on that. So But we're very happy to say that our members have come back. We are trying to continue with this education through the Alzheimer Association. We have a caregiver support group that, in coordination with the association, we're offering to our caregivers, because we are still limiting the people that are coming into our building. We screen everyone, including the staff, every day. We are, taking temperatures, asking questions, cough, fatigue, the regular, questions that the Center for Disease Control and Prevention has asked us to do. So shortness of breath, the diarrhea, chills, all those questions, we screen our members every day. We have the center deep cleaned. We focus on hand washing and sanitizing. So we are following all the CDC guidelines and DHEC guidelines to make sure that our center is the safest place for them to be, here in Mount Pleasant, because we can definitely control what goes on here. We still have, the nursing care and the rec program, and also we're providing them, delicious meals, top shelf. I can't say enough about them. The caterer that we have, they're doing a great job. And so we can make sure that they're provided with the meals and the socialization that they need, as well as the caregivers can continue to go to work.
So you really have that. It's a quality of life issue for far more than the members, the actual people that come and stay with you during the day, Diane.
Yes, absolutely. Yeah, it's for the caregivers. We're as much for the caregiver as we are for the people that come here.
Right.
They need that break. And trust me, when they weren't here, they really felt it. And they were very anxious to come back. So
I'm sure you're glad to see them back too.
And we're glad to see them back. Absolutely. Absolutely.
Thanks, Diane. Denise, same question for you. Tell us what Mount Pleasant Gardens has had to do to address these critical issues of health and safety for families and loved ones.
We weren't able to close our doors. Our doors had to stay open for our staff to come in and for our residents to be living here continually. So that was interesting because we were in a new era, really, in a new environment altogether. And when we first started this in March, it was ever changing by the minute. So policies would come over and new policies would come out. So we were constantly changing. And I do have to say the support of our home office has been exceptional because they've kept us abreast of every single thing that was changing. And we're on the outside, so we're kind of alone in our little segments, and they were our lifeline. So their continual work to keep us abreast of everything that was changing, as well as our own connection to other senior communities through the country, was really making a difference for us. But we had to keep changing, and we had to keep our staff who was scared because we've never experienced anything like this. So we were hearing all of the hard stories from the north, as well as experiencing our own little illnesses, because people still get sick even when there is COVID, and it didn't have to be that, but you didn't know if it was or wasn't because you weren't sure. So we continually every day had to, and if I use the word pivot, we had to pivot our everything we did, from walking through the door, through each moment we spent with our staff and our residents, and we also our families. We had to keep everybody motivated and caring. And I think that we as a team, our leadership team, really came together. And from my perspective, looking back, how scared we were was the catalyst to bring us together as a really amazing team. And I have to just say that was the beauty of this. As difficult as all of the different aspects of it were, there was such a beautiful environment of teamwork, and we're all in this together, and we're going to make it work. From walking through the door, like Diane said, like you have to have clean clothes on, you can't bring anything in. You have to make sure at the door we take your temperature. You have to answer the questions. Were you around somebody? Do you feel any different from yesterday? Now wash your hands, take your temperature, put your mask on your face, make sure it's over your nose and your mask, and, persevere, keep going till the end. And keeping that going since the beginning of March has been, a challenge, but an honor. I don't know any other way to say it. Working with the team has been incredible. The home office has been incredible, and the families. The support of the families has been exceptional. And, we know that at any moment something could happen. And we're just constantly working to ensure that it doesn't, but we even hear from the outside, we can't believe how amazing you guys are being with our family, because our residents, in even 3 months, 3.5 months, are just, they look good, they have great spirits, they're smiling, and that's what makes all of this worthwhile, really. And it's such a calling, and it's such an honor to do it.
Thanks, Denise. It really has to make you, at the same time, it's hypervigilance, but it's hyper care, right? It's care and feeding of your staff in a way that extends.
Mm-hmm. Yeah.
Yes.
And did you want to answer? You want me to, Diane?
Well, I just would like to piggyback on that because, I too, I feel that, we're a small staff, we're 3. And then of course we have, our owner and his family who have just been exceptional. This is a private memory care, and we could not be here without the contribution of the Rudick family. And the staff that I have, we're the 3 of us, and the families, why I'm just so touched that they have put the faith in us, knowing that their loved ones are going to be cared for here during this difficult time. And they just are just so grateful to us for the care that we provide them. And it is it really is a way, it's a tough time, but at the same time it's bringing out the best in people. And I can't say enough for the staff and all of us who, went in and we were tested to make sure that, we were safe to come back to take care of our loved ones. And it really is a difficult time, but at the same time, it really does make you feel like, yeah, we're doing the right thing by these families who do want to try to, keep them home for as long as possible, but they just can't do it by themselves. So we are following everything that we can and doing everything we can to make sure that our loved ones are safe and come back to us. So that's what they're doing.
Wonderful, Diane. I'm hoping if we have a little bit of time toward the end, I'd love to hear a story. We don't have to use names if you don't want to, but I'd love to hear a story of somebody on your team having gone above and beyond, because we're hearing the term healthcare heroes now, but it's never been more appropriate than right now. And so maybe we can have that conversation, time permitting. Diane, let's come back to you. Now that you've reopened, and you talked a little bit about that, what challenges do you see ahead for the day center for memory care?
Well, for a day center, I think the challenge is the uncertainty that, our loved ones, they want to be home, they want to keep them home, and we can control this environment. But once they go home, I just like to impress upon our families, this isn't life back to normal. This is where you have to, wear the mask, make sure that you do some social isolation. Trying to, especially for someone who has dementia, who has other, comorbidities and other things that are, not good, to try to keep them as safe as possible. And I know that it's hard. We've all had to pivot, as you're saying, is because, you know, you don't stop and go shopping and, you know, go to Mount Pleasant Town Center, which is like, you know, so difficult for some of us. We just can't do it. We just can't do it right now. But I think it's the uncertainty and not knowing how long this is going to be. You know, we can continue to wear our masks and things, but if you knew when it was going to stop, you know, we said, okay, by this date, everything's going to be back to normal. And we don't. And that's, for us, is the hard part.
Yeah, the virus seems to be immune to planning.
Yes, can't plan.
Completely immune to planning.
Mm-hmm.
Thanks, Diane. Denise, talk about the larger community of assisted living and senior care facilities. What do you see as short-term and long-term impacts of the coronavirus?
Short term, I think that it is just learning how to deal with this on an everyday basis. We've learned an awful lot, and I know that a lot of businesses are just reopening, and we've already gone through that in March. So we were dealing with how do we do this every day. And I think for us, it's the continued aspect of doing it all the time. So one of our favorite words is persevere here, you know, keep doing this till the end and until it's finished. And we don't know when that's going to be. And then, you know, for us as a leadership team, continually to appreciate that they're coming, everybody's coming to work, and they're coming to work with a smile on their face, and that they feel that they are in something larger than they are. And that to us is really important, that we're here for those that we were called to take care of. And that makes us all feel like we're a part of this big thing. And short term as well is, you know, our families, that they are not able to connect as they want to with their family members. So we've seen our window visits and our FaceTime that we're doing a lot of and continually trying to do that have been so helpful to the families. They're so special. The birthdays are special. You know, just that little connection when they see each other, all that worthwhile. And our staff, in the meantime, though, with, you know, we've been lucky that we've had some individuals that have just gone ahead and done that, our marketing individuals and activities. But then our staff are so focused on making sure that they have what we call our meaningful moments. It's knowing the resident so well that you know how to connect with them on a one-on-one or a small group level to help them to do things that they enjoy. It could be gardening. It could be listening to music. It could be dancing. They love exercise every morning. So, and that continues. So it's about making sure that the staff can have enough time and focus and resources to break up and connect with our residents to keep them enjoying their day and bringing them joy every day. So that's really short term, and short term is about the families. Long term, you know, for us, it's trying to actually connect our families back together. How are we going to reopen, and what is that going to look like? Because right now, you know, where we think that it should be slowing down, it's becoming a hot spot. And, you know, my husband and I, a couple of weeks ago, were driving to the beach, and, you know, I was watching the license plates, and I was like, New York, New Jersey, Pennsylvania. Like, you got to go home because.
And now they don't want us.
Right. And, you know, I panicked as well, you know. You just see that hotspot happening, and it is continued diligence, you know, with what we're doing, as well as, you know, what's going to stop this inside, because you're a small community, and we know from the north, you know, that the people combined together can spread this more. And, you know, we're looking at continuing the masks, continuing our everyday behaviors and keeping each other accountable to those behaviors. That's important. But also the environment of filtration, like what about the air? What about when it comes in? What can we do? And new technologies are coming out that aren't just about the medicine we're going to take, but about the things we can do in our environments that will stop the virus at its source, and make those things different. And, you know, I've been looking at some of those things, but, you know, we're continuing to hope that those areas start to open up for long-term care. But I do, the most important thing is our families too. You know, our families do also want to get back to normal. You know, and how does that look? Because they want to come and spend time in their room, spend time in our courtyard. What will that look like? And, you know, that we don't have the answers to. I think it's one step at a time and one trial at a time. And, you know, it's about being a team that can come together and say, this worked well, what can work better? And how do we make that happen? Because our goal is the care, the love, and the, you know, and the safety of our residents. And that's been important for us.
Denise, it sounds like in the middle of that there's still joy going on inside there.
Oh, we have so much fun. We really have wonderful time with them, and they just have such a sense of humor. You know, sometimes when they see their family members from the window, you know, they don't realize that they can hear them through the wall. And they'll say, "Oh, she doesn't look good," you know, or you know, they'll say, "What is she doing? Why is she standing there? And can't she come in?" So it's been really interesting to hear their take on it.
Oh yeah, especially with the mass, you know, because people that have memory loss, this is what they pay attention to, your expressions and your tone of voice. And that has been a challenge because, you know, what they must be thinking, you know, why are these people walking around with, we have the clear, you know, mask and, you know, I try to put that on as often as possible because they want to see your face. They want to be able to hear you. And the other part is the touching, you know, that sense of touch that, you know, we're missing now. And it's really, really hard, you know, because they're not used to that. So it's a real challenge. But I also wanted to kind of bring up the fact of the expense of all this for businesses. You know, when you talk about, you know, getting all these extra, you know, services and, you know, I've seen on television where they have these air fresheners and these controllers, you're talking, you know, hundreds and hundreds of dollars. And, you know, for a small business, you know, such as ours, this has really, you know, been a challenge to meet all those needs. You know, you're getting the extra gloves and the extra masks and, you know, doing all these extra things. And it really is a challenge for, you know, a smaller company, which I'm sure that, you know, all the smaller companies here in Mount Pleasant are, you know, having a challenge with. It can be, you know, a huge expense for us. So, you know, we're just hoping and praying that every day, you know, that they'll come up with a vaccine. I think that's down the road, but can't get here soon enough. But it is, and it really is a real benefit and a real blessing that we are able to keep our doors open because so many of our families want to keep their loved ones home and know that they can go to someplace safe, but at the same time take care of themselves. So we're hanging in there, and you know, we just can't say enough about, you know, the family and all the families that come and see us because they're putting their faith and trust in us to do the right thing.
And thanks, Diane. I can't commend the two of you and your colleagues in the work that you do and the care that you provide. I can't commend you highly enough for working with a population that is disproportionately adversely affected by this virus. You are serving the single portion of the population that is most at risk. And in order to do that, to, you know, take care of them the best way that you can and by the guidelines that have been provided, as well as, you know, just being able to still care for them. And so I suggested a little bit earlier that I would maybe ask you, and I think we have time to do it, tell a story, if you will, about somebody that's gone above and beyond. And it doesn't necessarily have to be on your team, but somebody that you've noticed in your awareness that has made a difference by doing something that would be extraordinary, a little bit out of the ordinary.
You know, I thought about that as soon as you said it. I said, you know, who would I pick, you know, that has gone above and beyond. And I think that that's where I just really have to kind of bring it around to my staff and probably tell a little story about in the beginning, we had one resident who came down with a little cold, and of course we all suspected the worst, and we quarantined her to a room, and everybody was scared. Everybody got so scared because we were hearing all of these stories. And, we all ran around and got our PPE and walked it, what were we going to do and how are we going to do this? And I think that the thing that happened with the staff is it brought it all up, and it said, these are our loved ones, like they're those family loved ones, and we're going to be here for them. And there was not one staff member that walked away from going in that room, from getting the food that they needed, from providing the support for the ones that came out to say, thank you so much for going in there, because you know what, I have a young girl at home or a young child at home, and I'm afraid, but thank you for doing that. Every shift came in without complaint. That is extraordinary, John. And to me, that has been, I can't tell you one story because every story has been the housekeepers, the dietary aides, the care staff, the activities people, our programmers, our leaders that have just stepped up. And the other thing is the families. Like, my family goes and shops for me. If I don't feel comfortable somewhere, they will walk me away because they know who I care for. That's been our heroes too. Like, our heroes are the residents. They've been dealing without their families for a long time. Our heroes are each other because we just blend together and we're working to just keep each other up all the time. And it's just about love there, and our heroes are our family members who know where we come to work, and they provide for us to be able to come and do that, knowing how important it is. And, and we've done a whole bunch of little things like, the giveaways, the parties, the families have sent us more food that I can even count on, and that's all meant a whole lot. But, one story is the story of the team. It's the story of just each other, loving each other, and knowing what we do every day makes a huge difference in the lives of our residents and our own hearts. So that's where I would come and kind of leave it.
Thanks, Denise. I appreciate that. Diane, do you have a story to tell us?
Well, like Denise, I think it's hard to say one person, during this whole period of time. Obviously, my staff, they're fantastic, the nurse and Cece, and when the time that we were out, they were still on Zoom, trying to help out the best they could. But I'm sitting here looking out the window, and I'm looking at our garden, and we decided that we would like to have, start a garden. We've talked about it for a while. And one of the caregivers mentioned to me that, I know where you can get one of those little stand-up gardens, and like a wheelchair garden. And so I mentioned it to one of the granddaughters that was dropping her mom off one day, grandmother off. And I said, I want to get this garden, but I know, it's going to be some work put together. She said, I can do that. I can put that together. And this young girl, she's early 20s, I got it. She carries it out. It must have weighed about 50, 60 pounds, and she puts it together. And my nurse, Claire, she started bringing in some tomato plants from her garden, and green beans and sunflowers. And it is so beautiful. And our members just love it. They look at it every day, and they get excited when they see a little tomato growing out there, or the sunflowers, and the bird feeder that we have out here. They really enjoy that. They get all excited. Oh, there's a bird on the bird feeder. And they're just like, and that is just, it doesn't take a lot, but just little things like that they take pleasure in. But it really is a community effort. And I can't say enough, for David and his family, because otherwise we wouldn't be here. And we're a small operation, but we're mighty. And I really feel that I am indebted to everyone that helps us to to stay in business and take care of our loved ones.
Thanks, Diane. I appreciate that.
We have a lot of basil that we're growing and parsley.
Yeah, we have basil too.
Add that basil to your tomatoes, hopefully.
Yes.
Get our
It
residents
smells so
together.
good.
Get our residents together, and it's been a nice partnership between Mount Pleasant Gardens and Alice's Clubhouse, and we really do appreciate all she does, and vice versa. We've had some really nice parties.
Yes, we have. Yeah, we'll have to do that again, Denise. Something to look forward to.
Very good. Hey, thank you for that. Rebecca, let's get you in here for a second. I think we might have some input or some questions perhaps from our those attending.
Hello there. Thank you so much, Denise and Diane, for your insight today and all that you're doing for our senior community. I guess from those who are watching today and they don't have aging loved ones yet in a community type environment to help them through the various stages of dementia, those who are watching this, how can they help their loved one? What are some things that they should do or say as a family? Because this is such an unusual time. My dad is 90 years old, and I said to him, I bet you never thought, having grown up during the Depression, gone through World War II, survived all the things, the decades of what you have faced. Now something called COVID-19 has turned our world upside down. You thought they'd seen it all. So any words of advice for family members who want to stay in touch with their aging loved ones, particularly if they see some signs of dementia, how best to assist them with understanding what's going on, and when should they decide to seek more assistance from Diane, your facility during the day, or Denise, yours, where they are getting more skilled type care? Those are hard decisions to make as a family.
Yes, indeed. Let's, Denise, can we start with you on that one?
You know, it's really definitely, you're right, Rebecca. It's a hard choice to know when. And, you know, our Alice's will do the daily things. And that's always a great place to start, because they're not, once they come in here, they really will not have that connection to them other than FaceTime and window, which is fine, you know, but at some point you get to that point where you realize mom and dad need more help and more oversight. They're leaving their home. They're not understanding the simple daily tasks that they need to do and caring for themselves and being alone. You know, a lot of people say, oh, it's got to be so difficult, but you know, they have friends. They're all friends back there. So they still have each other, where a lot of people are at home alone. So they make a connection, and a lot of them start to they rejoice, actually. They start to, you know, like, we're social animals. They want to be social. They want to be friends with people. They want that connection. So they thrive when they come into a community that, you know, really kind of focuses on their social and spiritual and, you know, and their daily living. So if you get to that point where they are isolated, or you are at that point where they can't, it's very difficult to take care of them at home and to manage them at home with everything else going on in your home, you know, it's time to have that conversation. And, you know, what we're doing is we're keeping that connection thriving between the family members and the, you know, and the residents through the conversations, the FaceTime, the window visits. We have a smile network that we're connected to all the time. So you don't lose that connection with them, but what you do is you gain safety for them. You gain, you know, the ability for them to become part of a community and to live a life of joy and love again. And I think that it is a very tough decision. We've had a few people that have moved in through this time, and we have to do that isolation. But the way we worked it through understanding is close to our outside so the family could come and be still a part of their lives without touching them. So we are doing that well, and our residents that are moving in with us after those 14 days go right back into our community and start to thrive in our gardens, in our community, and, you know, just as a whole.
Thanks, Denise. I appreciate that. Diane?
Yeah, well, I think that, you know, the adult daycare and Denise's, you know, the assisted and memory care, it's a whole continuum of care that is in the healthcare field right now. And people and families are, right now, I think it's the best time because we are really evaluating people much better than we used to. I always recommend to families, if they get a call and they don't know where to start, I would start, you know, with the physician, because you really have to evaluate your loved one. If you've got a 90-year-old who maybe occasionally gets forgetful, but he's isolated and he's home and he's bored, well, then, you know, we could say what we do here is we have a trial day and they come in and we evaluate them. My nurse evaluates them, and I do as well. And I just had that situation today. I had a woman who came in with her husband who was very young, diagnosed with Parkinson's related dementia. But he is still able to, you know, participate and do some things for himself. But he's just bored. He's bored at home. And that really is the focus of, you know, what we try to do here. And it sounds like, you know, Denise is doing that as well, that you keep them active, you keep them social, you keep them engaged. Because all the research shows that the more cognitive stimulated they are, the better their memory they can retain, because they're not just sitting home by themselves and alone. But this is all part of that continuum. And any family that I meet with, the first time I meet with them, I say, well, we'll have them come in, we'll meet with them, we'll evaluate, and we will make recommendation. We might say, okay, I think that they would be appropriate for the day center because we take in individuals with early to mid-stage dementia. I want them to be able to participate in the program, get something out of it. That's what the families are bringing them here for. That's what they're paying for. That's important. But I always, the very first time I meet with families, say, I want you to think about what you're going to do long-term. And Denise, I did, you know, mention to the spouse, you know, I have a list of a few people that I will recommend for long term, because I don't want the families to all of a sudden think, oh no, you know, when Diane calls me and says my loved one's progressed and they can't stay at the day center anymore, what do I do? So the very first time I say, I want you to think about what you want to do long term. We would love to have them here for as long as possible. In the day center that I was a director of up in Connecticut, I had an individual up there for 7 years in the day center.
Wow.
Now, when you think about the length of time that is, and of course, much more cost effective over all those years, all the money that the family saved because they didn't have to put them in the long term, and they were appropriate for the day center. But they were so stimulated that they were able to still engage and participate. So that's what was really good. So I would recommend to families, make sure you have a good connection with a physician. You know, I recommend geriatricians, just like you take your child to a pediatrician, take your loved one to an elderly person to a geriatrician, and have them evaluated, because sometimes they can have some memory and confusion, but it's not related to just aging and dementia. It's a medical problem. Maybe they're not taking their medications properly. So there's a lot of different reasons why they could be getting more confused. So making sure that you get them evaluated, and then, you know, if you're interested, stop in and you can talk to me. I've always said that I want to be known as a community resource, not just the day center. If you have any questions, know a lot of people in the area. And so I think it's important that, you know, families don't know where to start. So if you have any questions, you can always reach out to me, and I can see if I can help you.
I think that's great information, both of you, Denise and Diane. Thank you for sharing that. And I encourage anyone who's watching this live or on the recording that if you have an aging loved one, it's just a really difficult time to decide what would you do right now in terms of getting them care when you realize, because this is not ending anytime soon, and how do you get them the proper care and find out those resources. I put both of you on the chat box and how to reach you, and I know that both of you are more than happy to answer families' questions and moving forward. And thank you so much for sharing everything today. And thank you, John, for letting me talk a little bit more than normal. But, you know, this is a topic near and dear to my heart, the senior population. And I just want to say on a personal note, thank you, ladies, for all the energy that you're providing, because I have friends, I'm a sandwich boomer, so I have, yes, an aging parent, but I no longer have young children at home. My friends with young children at home, they're like, yay, it's summer, I don't have to school them anymore. But if you, but you're in a situation where you're continuing to have to keep your energy up as you take care of these aging clients. You're not really getting a break, are you? You just keep going, and it sounds like it's because you love what you do and you're passionate about it that you have that wonderful energy. So thank you.
Well, thank you. Thank you, Rebecca.
Yeah, thank you for loving what you do. Let's give each of you a chance to add a final thought. And Diane, let's start with you. A final thought on what we've been discussing today.
Well, I appreciate the opportunity to do this. I think it's important that people out in our community understand that, you know, Denise and I, and Rebecca, you hit the nail on the head when you said we have a passion. I think you can hear that. I can certainly hear that in Denise. You know, you have a passion for what you do, and whatever you have a passion for, you're going to be good at. And I just really want to impress upon families that if you do have a loved one who is elderly, it is so important to keep them engaged in social. And as social work, we used to talk about that pie and making sure that every piece of that pie was even, you know, everything from spirituality to exercise to nutrition and also social. And so this is wonderful, the Zoom, and I'm so happy that we have that. We're still able to connect. But you know, it's hard to replace that personal touch. So please, you know, when your loved ones are home and you know they're by themselves, it is possible to have them out and in safe place in the community and during this very, very difficult time for all of us. But I appreciate the opportunity to talk to you today.
Sure, Diane, glad to have you. Denise, a final thought?
I think, as Diane said, you know, when you start to go through this, there are so many available resources that you need, and you need to reach out. And I think that's my biggest thing, is don't be afraid to reach out. We're not here just for, we're here to be able to hear your concerns, hear what's going on in your life, and help to direct you to resources that you need, you know, whether it be outside areas and doctors that can help in the beginning stages, like Diane said, or a daycare program, or a program like Mount Pleasant Gardens. And, you know, the thing about it is that we all have to, you know, think about, you know, what's going to be best for that resident and that individual who's going to be journeying through, because they're concerned and they're anxious because of what they're going through, and you're anxious as well. And we've been working with this for so long, and we do know the steps. We see it, and we know how to guide you along what's best for your loved one. And that's what our ultimate goal is. That, you know, I have an aunt who has Alzheimer's that I care for, and I know my resources were there for me even when I was working in it. And we need each other, and we need to hear that, and, you know, be compassionate and work with you side by side. And I think both Diane and myself and our teams are all dedicated to that we want to help you as a family navigate this journey. And that's really important. And for those that are just starting to go through this with their teams as well, it's just about that consistently keeping that motivation up, and that you're here for a reason, and, you know, live your calling, and just live joy and love every day. It makes a huge difference in this time.
Thank you, Denise, and thank you to both of you for being right there on the front lines. I heard something recently that made a big impact on me when somebody said he was in his business for years, and when people would come in on his team, they would report to work and he would say, "Thank you for coming in today." And I thought that was a most appropriate phrase and greeting for everyone from the grocery store to the doctor's office and everyone in between. So I've adopted that, and people really take kindly to that. They take kindly just for being recognized and noticed for the fact that they they did what we really need them to do. So I thank you, Diane Sancho, Executive Director of Alice's Clubhouse, and Denis Kish, Administrator of Mount Pleasant Gardens. Thanks to all of our chamber members with us live and those catching us on the recording. And a big thank you to Mount Pleasant Chamber's own Rebecca Imholtz for keeping us on track today. From all of us at the Mount Pleasant Chamber, thank you for joining us this week for The Pivot. Make it a great week.
Bye.
Bye.
Bye, Denise.
Bye, Diane.
Bye.